As vaccination numbers continue to grow, so too has the call to make sure frontline healthcare workers get their shots to further protect themselves and others from COVID-19. Some say it's now time to make it mandatory, but with that, individual rights come into question.
They're in their high-risk area, right? If they're protected, that's best for them, right? And best for the patient as well.
From a patient perspective, they want the best possible care and protection possible while the fight against COVID continues, even if it means telling healthcare workers they need to be vaccinated to do their job.
Yeah, we absolutely should be considering mandatory vaccinations for healthcare workers. I mean, we work with the most vulnerable of the vulnerable. We work with immunocompromised individuals. We work with people who are susceptible to getting infected and susceptible to having severe outcomes from infection.
A number of European countries have now implemented policies for health and long-term care workers, or they could face penalties. As of this month, Ontario long-term care homes are required to have vaccination policies in place for staff. But the province itself isn't making workers get their shots, just asking nicely.
Folks, if you work at a long-term care, we haven't made it mandatory. I don't believe in forcing vaccines on everyone, but please get vaccinated.
Individual civil rights would come into question in Canada if the government was to step in. An ethical dilemma that some experts say is a slippery slope depending on what workers do.
If we can find ways that are less coercive, less intrusive than mandatory, we really need to explore those. Because to make it mandatory, you are intruding on a person's rights.
The Canadian Medical Association tells CityNews the CMA has been heavily involved in efforts to increase vaccination rates amongst Canadians, including healthcare workers. Those efforts will continue. As medical professionals, we have a responsibility to keep our patients, our families, and our communities safe. Ontario's counterpart says that any decision should involve local institutions, but the need is there.
The case to be made about the COVID vaccines for healthcare workers is a very strong one, and we are seeing jurisdictions like Greece and France and Italy mandate that for their healthcare workers. And so this is an ongoing conversation, I think, in this province and in this country.
A conversation that has been going on but has now reached a critical point for those receiving care.
If you're dealing with anyone vulnerable in the hospital, you should, particularly vulnerable, ER or the cancer ward, then yeah, you should be required to vaccinate.
As of Monday, Ontario's Ministry of Health says more than 700,000 healthcare workers in the province have received at least one dose of vaccine, and over 648,000 have received a second dose. We also reached out to the Ontario Nurses Association and have been told that it will not be commenting at this time.